So, hello everyone. So, I'm Dr. Sameeksha Das. I am a PDF in Geriatric Psychiatry, which is essentially a one-year course that we do to learn about the mental health issues in older adults. What we address them as our older adults or elderly, so more than 60. And so I am currently working in a project which teaches MBBS doctors and psychiatrists about geriatric psychiatry or geriatric health issues, because this is an area which not a lot of people have idea about. And we feel that this is our duty because we are working in this sector. We need to disperse, or we need to tell everybody regarding this, and we need to share our knowledge. So I am working as a senior resident in that project, in which we train physicians and psychiatrists regarding geriatric psychiatry. So today chose a topic which is mental health impact of chronic illnesses in older adults. So as we are going to grow old, or we are already old, we will have certain chronic illnesses in our life. So till now, still a long time, we have this idea that these are just what is affecting our body, and we have mental illness as separate and physical illness as separate. Okay, but now with time we have realized that it is not that. It is not something which is completely separated. There is some definite entwining of the bodily illnesses or physical illnesses and mental illnesses. So whatever is chronic, and a chronic illness is going to affect the mind and the mental health also. Yeah, just a second. Yeah, so PDF Geriatric Psychiatry. So, mental health impacts of chronic illnesses. So, chronic illnesses are the long-term health conditions that often progress slowly and persist throughout life. So, we see that these illnesses start at the age of 40 or 45, and it can continue till the very end. And as you grow older, you have more likelihood of either developing this disease, or the effects of these diseases becoming apparent. So the common examples in older adults can be arthritis, Parkinson's. I think most common are diabetes and cardiovascular conditions, which also includes hypertension. So all the older adults or the patients that we receive or that we get in our geriatric OPD, I think diabetes and hypertension are the most common comorbidities that we get. Also, that in males we see BHP or benign hyperplasia of prostate. Along with that, there can be chronic pain and COPD. So these are the chronic illnesses that we encounter in older adults. And as people age, they are more likely to develop such conditions. And as I said, they do not just affect the body, they can deeply impact the mind as well. So there is a mind and body connection. Okay, so this is a two-way street, what we call the mind-body dualism. So there is a bi-directional relationship between physical and mental health. So if one is getting affected, automatically the other health is definitely getting affected. So if you have a chronic illness which is, you know, making you physically weak, or which is affecting your physical health, this can trigger or worsen mental health issues such as depression, anxiety, and it can also lead to cognitive decline. Conversely, if you have mental health problems, they can worsen your physical symptoms. And this can reduce your treatment adherence and increase disability. So, whatever I'm talking about, I'll be explaining in detail in the next slides. So, how mental health problems worsen physical health in older adults? So, if you have a mental health problem, how is it going to affect the physical illness? So, first is the exacerbation of physical symptoms. So, depression and anxiety can amplify the perception of pain and fatigue. So, if you're sad, if you're not feeling good, if you're anxious, if some kind of like depression is there, you're going to feel the pain more. So the our mood affects the perception of pain. If you're feeling down, definitely the pain will be perceived as more. On the flip side, if we are happy, then we can manage a bit of pain. Like, no, it's okay, I'm fine, I'll manage. So that is what is the meaning of this, that our mood can amplify and change the perception of pain and fatigue. If you're very happy, you will keep doing work, neglecting that you have any physical fatigue. Whereas if you are down, if you're sad, you will feel tired and fatigued very easily. So a lot of time, patients who have depression, who themselves don't know that they have depression, they'll keep complaining, I feel tired, I feel tired. Whatever small work I do, I feel tired. And this can be due to the fact that they are actually depressed. And even small amount of physical activity can make them feel that they are fatigued. Uh, so this is how depression can even manifest in some people, where they perceive, small pain can be, come across as intolerable. And small physical exercises can make them feel fatigued. And mental distresses may intensify symptoms like breathlessness, or any kind of, disability you have, any kind of symptom you have, that is going to be aggravated when you have depression. So if you have COPD, you'll feel more breathless. And I think a lot of you must have observed or heard that in Parkinson's, when the person is depressed or the person is anxious, the tremors start increasing more. And whenever you take stress in diabetes, your sugar fluctuates. If you are depressed, the blood sugar will shoot up. Okay, well, you are happy, and you are able to maintain your, good lifestyle, then blood sugar is going to go down. And this is also due to heightened stress response, which affects multiple organ system. So whenever we are depressed, with depressed or a small level of anxiety, so when you are depressed for a small time, then you go back to normal. That is okay. Like, that is life. That you will be sad and not depressed. Actually, that is the wrong word. When you're sad for some time, or mild kind of anxiety is a part of your life. So if you're not anxious about a presentation, there is something definitely wrong. So some amount of anxiety helps us prepare for the challenges ahead. But if it's a chronic stress is there, if you're always anxious, if you're chronically depressed, what is going to happen is your mind is going to show certain changes. So this is what we call heightened stress response. Okay, so stress response for a small time is okay because it helps us survive. Whenever there is an obstacle, the stress response will help us deal with that response. But even if you remove the stress, okay, the exam has gone down, still you keep feeling anxious, keep feeling depressed, or some situation you have no control on. So you keep feeling depressed about it. That is going to set in a chronic stress response, and because of this stress, your organs are getting affected. So in diabetes and hypertension, we see that very evidently. I'll talk about it in the later slide. But this is how what is going to happen, that if you're always stressed, always, there is an underlying depression, then you're going to have chronic stress. For example, older adult with arthritis may perceive pain as more severe if they are struggling with depression, even when the inflammation is controlled. So very rarely you will see a happy person, confessing, complaining about pain. They may have pain, but they will be able to manage with medication. A lot of times when the pain is not able to get managed by medication and all that thing, there can be underlying depression. Okay. So second is when you have a mental health issues, be it anxiety, be it depression. Depression is something which is very common. What is going to happen is there will be reduced adherence to treatment. For example, if you
Madam, you are disconnected. Doctor, madam. Doctor, madam, you are disconnected. Madam, you are disconnected.
Sir, please call on her mobile.
Yeah. Call her. Call her.
I'm trying to connect with her.
Yeah, please. I also have number.
Hello, are you there, Sameeksha madam?
No, she's disconnected.
The screen is just visible, but the
Yeah, I'm back.
Cursor is moving. Yeah.
Yeah, I'm back. Oh, yeah.
Yeah.
Yeah, I'm sorry. Yeah. So, coming to reduce adherence to treatment, depression can diminish motivation, leading to skipped medication, missed appointments, or neglecting diet and exercises. So, all these things require motivation. You require you to be disciplined, to be motivated. You should have, this should come with, this feeling that I have to do this so that my treatment is better or I am getting better. When there is depression, even small activities feels very difficult. In depression, people stop eating, people stop taking care of themselves. So how do we expect them to be compliant to medication, for coming on appointments and doing exercises, or maintaining their diet? So that is why depression is something that complicates even the treatment, so it is hampering the treatment also, because people do not have that energy or the motivation to do all these things. Okay. uh, and cognitive impairment or anxiety may also make managing complex treatment regimens overwhelming. So, if a person has a kind of diminishing cognitive cognition, they are not able to keep track of medication. So, even simple medication treatment are going to be difficult for them to handle. Same with anxiety. When we are anxious, we are actually overwhelmed. Even small things make us feel that, we are not able to do anything and it's too much for me. Okay. So, that is how it is also affecting the way we respond to our illness. Okay, so if there is an illness, there is of course the biological part of the illness that we have to deal with. We have to take medication, we have to diet, we have to exercise. Along with that, if you develop depression because of the illness, so what we call a reactive kind of a depression, that depression has developed because of a reaction to the illness, physical illness, or it can be something you already have. Maybe you had some kind of subsyndromal depression, or you have had depression in the past, or it has become very difficult for you to cope with a new diagnosis of a physical illness. And this is how, along with those challenges that you face due to the physical disease, they are going to get aggravated due to the mental health issues, and along with that you will have mental health issues. So this is kind of a vicious cycle that is going to be formed. Okay, so poor mental health, if you have poor mental health, it becomes very difficult for you to get a proper treatment, go on appointment. So there will be mistreatment. Okay, you will not be able to take care of yourself uh, very properly because of poor mental health, poor motivation, low mood, energy, or lack of energy. Okay, and because of this mistreatment, because you are missing out on this treatment, your physical health is going to get worse. So when your physical health is getting worse, we have talked about mind is connected to body, you will have worsening of mental health. So there can be deeper depression, and that can lead to further neglect of care, and then finally poor mental health again. So this is the vicious cycle that keeps on happening. Okay, so a lot of times you will have maybe your friends, maybe somebody who feels who will be always sad and depressed, and you can make out that they are not keeping well and they are not able to cope well. But when you ask them what is the deal, oh, nothing, is just my arthritis, oh, it's nothing, just my diabetes. So what we tend to do, especially in countries like India and Southeast Asia, we tend to attribute our suffering more to a physical illness. Okay, we don't understand that maybe we are also suffering, maybe because of the physical illness we are also having mental health issues. So a lot of times it is just that, okay, if it's just my arthritis or it's just my diabetes, I don't know, whatever I try, it's not getting better. I'm taking medications, it is very hard to go for diet and exercises, but I'm trying, I don't know, nothing seems to get better. I'm losing hope, I may never get better. So this is the kind of picture you will see from somebody who is also struggling mentally along with the physical health issues. So there is increased risk of disability when you have mental health issues along with physical issues. So there can be emotional disorders that can lead to social withdrawal. So with depression comes the social withdrawal, physical inactivity where you are not motivated to do anything, and because of physical inactivity, there can be muscle deconditioning. So this is a concept that we talk about in geriatrics a lot, is to keep it healthy you have to keep it moving, you have to keep utilizing it. If it is your brain, if you want to prevent cognitive decline, you need to keep using your brain, you need to keep it active throughout your life. So then your brain will have a better chance at fighting cognitive decline. Same, if you don't use your muscle, you don't physically, you don't exercise, you don't go out, you don't do anything, your muscle mass is going to decrease. Okay. So one of the reasons of frailty in older age, of course, this is because of the biology also, but one of the reasons of frailty in older adults can be they are not exercising properly and muscle deconditioning happens. Okay. And mental fatigue can also contribute to false frailty and a loss of independence. So if you are mentally fatigued, you lose the will to do anything independent, and you feel that you are incapable of doing anything. You may be capable, and a lot of times family members will say he doesn't want to do anything, we have seen that he can do. Sometimes he'll do, but at times he just wants us to cater him. They take it in a way that the person is being dependent on them or actually being a nuisance. Very few family members, but there are some. But what is happening is when the mood is a bit okay, they will be able to do things. And when the mood goes down, again, they become very incapacitated and, lack of confidence in themselves. And they just lose uh, even interest in doing anything. And there can also be falls and frailty because of that. Okay. So mental fatigue can contribute to all that. Then coming to anxiety about physical limitation may prevent older adults from even trying rehabilitation exercises. So if you ask somebody that, you can have rehabilitation exercises, you can do physiotherapy and, this will improve, your activities will improve. But if you feel that, nothing is going to work and you are not capable of anything, you won't even try. So this is why this is kind of a mental block that will happen in older adults because of anxiety, in which they feel nothing is going to work out for them. Okay. So that is why dealing with anxiety and depression in older adults is very important. So higher healthcare utilization. Okay. So people who have physical illnesses are going to use healthcare. Okay. But with mental health issues, this is going to be compounded. Okay. So older adults with untreated mental illness issues and chronic illnesses tend to visit emergency rooms more often, have longer hospital stays, use more medications, report poor quality of life overall. So you have treated all the physical illnesses. You have, given the proper medication for diabetes. You have given the proper medication for hypertension, but still the patient is not feeling good. They may complain of some vague pain here, there, arthritis pain is too much. I'm not able to sleep properly. I'm not able to breathe properly. Okay. And so these are the symptoms that are going to persist, because probably these are not due to the physical illnesses. These are due to the low mood or the, mental health issues that are there. Okay. So they will keep finding reasons to visit hospitals more often, because they don't feel good. They attribute everything to the physical illness. Like I discussed, we have a tendency to attribute everything to physical illness, to the body. So they'll keep visiting doctors and saying, I don't feel good, I don't feel good, this is the problem, this is the pain. When you ask what is the problem, they may tell you some pain, uh, because that is what is there in their mind, and this is how they perceive their distress and pain.
So again, you are cut. Sorry. Right. I have informed her. She is just coming back. There's a problem with her internet connection. I have already spoken to her. She is just coming back. Sorry for that. See, this technology certain times playing a...
Yeah, I'm sorry for the repeated
Yeah, no problem. No problem, Doctor. I think
network issues. Yeah,
it's a
yeah,
technology.
yeah. I should have taken it from NIMHANS, maybe. Yeah. Yeah. So, okay. So, Shivam, where was I? Can you just tell me where was I?
You are again talking about the connection between the mental health and the physical health, and people feel very low because of that. I mean, they
Had I
often
reached, sir, had I reached this slide?
slide number 5. You are now on 4, doctor. Have a longer hospital stay, use more medication.
This I have reached. Okay, sure. Yeah. So ignoring mental health in the treatment of chronic illness is like fixing the roof while ignoring the foundation. Okay. So you're just dealing with things superficially. We are not going into the depth of the problem, which are mental health issues. Okay, physical illnesses are easy to take care of, not easy, but definitely easier than, talking about mental health issues to somebody who doesn't want to talk about them. But these are the things that are going to affect the physical health. So for older adults, we need to integrate mental health care. So mental health care is not optional. It is essential for full recovery and healthy aging. Okay, why older adults? So there can be a question that why older adults are more vulnerable. So why older adults are more vulnerable for mental health issues related to physical illnesses. So there has been physical changes, psychological changes with age. So there's change in brain chemistry, sleep patterns. So older people, as they grow older, the sleep becomes limited. Deep sleep is hard to get, and the brain threshold changes with age. So this makes the older adults more sensitive to stress and chronic symptoms. Good sleep is definitely something which is important to deal with stress and to feel good and to, kind of reset the brain. So as you have reduced sleep, then these people are more sensitive to stress and chronic symptoms. Okay. Second is loss of independence. So some conditions such as arthritis or Parkinson's can limit mobility and increase dependence on other. So people who are independent all their life because of some physical illnesses, if they are getting dependent on others, this can come up as a, stress or something that they have difficulty in coping with. Third is social isolation. Social isolation, withdrawal from social activities due to physical limitations, and this can lead to loneliness, and this is a major risk factor for depression. That is why we encourage social activities in older age, especially. So mid to old age, social activities are something that people should engage in. Even if you have some physical limitations, things can be done. If you can't walk properly, you can take a wheelchair, or something can be done so that you don't feel lonely, because the more lonely you get, the more easy it is to have depression. Then fear of disability or death. So whenever there is a person who has been newly diagnosed with a physical illness, so one of the things that they may experience is this essential stress or existential stress, that they are going to have declining health and they are not going to work as properly as possible, and they may even face death in future. So this face to face with mortality and with morbidity and with physical illness is definitely something that happens in older age. Then polypharmacy. So sadly, older people are the most sensitive to uh, polypharmacy because of, the body has aged. A lot of systems are, declining, aging. So aging has set in. So that is why these people are the more sensitive to medications. And unfortunately, these are the, this group of people are the ones who are subjected to the most polypharmacy. So polypharmacy is using multiple medications. So multiple medication can affect mood. So a lot of medications themselves have effect on the mood, cognition, and they can contribute side effects that impact quality of life. So a lot of times we get patients or older adults that are coming to us with at least 12, 13, 14 medications, which they take daily. And because of one medication, they're having side effects, which is being treated by some other medications. So we have, a basket of medications which are maybe treating each other's side effects and overall not making the quality of the life better for the person. And the person is just taking medication, thinking that if they don't take medication, the health will go worse. So a lot of times when we have such polypharmacy, what we do, either we admit the patient in case they get, if they are ready, and we slowly try to reduce all the medications we feel is unnecessary. And this has to be done in a sequential manner. So unless and until some medication is definitely causing a side effect and you are very sure, we can stop the medication at that time. Or else what we do, we stop the medication one by one, giving the body to adjust, and we see, what is working. And sometimes if we feel, no, if by stopping medication we have made the situation worse, we can start. So this is kind of a slow process that we do so that the person is on the minimum number of medications. Okay. And like I said, older adults, more polypharmacy and more chances of having them depression. A lot of heart medication can affect the mood. Lot of anticholinergics which are used can cause for psychiatric issues that we use that cause problems in cognition. Okay, so polypharmacy can make them more vulnerable. Yeah. So what are the common mental health impacts that we see with chronic illnesses? So coming to the chronic illness, arthritis. So there can be depression due to chronic pain and limited mobility. Okay, the arthritis pain is definitely uh, hard to bear. Sometimes it's aggravated. Sometimes the person is not able to be mobile and they need support. And essentially there is not a very good cure for arthritis. It just can be managed by physiotherapy. Some you know maybe you can go for a replacement, that is another matter, but arthritis is definitely very closely linked to depression due to chronic pain. Then Parkinson's disease. So Parkinson's disease is a movement disorder in which we get a lot of psychiatric comorbidities. So depression is one. Apathy is one. Apathy is when you actually don't feel emotion, you're not motivated, that we call apathy. There is anxiety, there can be psychosis. So a lot of medications due to Parkinson's disease. So in Parkinson's, there is low level of dopamine. So what we do is we supply dopamine, which is called levodopa or syndopa, from outside. So this can cause psychosis itself. So a lot of medication that we use for Parkinson's disease can cause psychosis. So psychosis is kind of very common in Parkinson's disease, and cognitive decline, what we call Parkinson's disease dementia. Diabetes. So diabetes is very common in the general population, and we see anxiety about the complications, depression, sleep issues. Then stroke. So post-stroke depression is as high as 30%. So 30% of people who have had stroke can have depression, and it is very common. Then can be frustration, and then can be identity loss because of the residual effects of the stroke. There can be paralysis. Some people may require others to clean them, or a lot of dependence can be there. So this can make them feel that who am I? I have lost my identity. So this is what we call identity loss. Then heart disease. So a lot of time heart disease is associated with anxiety, the fear of recurrence. So if it is an MI, you can always be scared that I will have a repeat MI, or there can be mood instability with heart diseases. Okay. Then chronic pain condition. So pain is a very big risk factor for depression and even suicide. So people, so with cancer, we see that if cancer is associated with chronic pain, there is high incidence of suicide because it's too unbearable. Almost the cancer pain is unbearable. So if there is a chronic pain condition, it can lead to depression, irritability, and suicidal ideation in severe cases. Suicidal ideation is the thoughts of getting suicide or death wishes. Okay, so here I would like to, highlight this hidden link. This is depression, hypertension, and diabetes. I have made a separate slide for this because these are the two most common comorbidities that we get in older people, or we may get when we get older. So here also there is a mind-body interaction. So the depression can worsen blood sugar and blood pressure control. Okay, and stress and mood disturbances influence cortisol and adrenaline level. So we talked about chronic stress. So the what does chronic stress mean? So the body is trying to, whenever there is a stress in your body, in your mind, what is your body trying to do? It is trying to make you face those stress, and because of that you secrete cortisol and your adrenaline is high. These are the two hormones. But what happens in chronic stress? These are persistently high. So if the persistently cortisol is high, adrenaline is high, there are going to be definite changes in the brain. So stress and mood disturbances influence cortisol and adrenaline level. And cortisol is something that releases sugar into your body. You need sugar to fight your enemies, right? So whenever there is a stress, cortisol is increased, there is increased sugar in your body, and you have the energy to fight with a lion, with anybody else, whoever is the danger. But what happens if the cortisol is always high? So you're going to have sugar in your body all the time. So this is going to be hyperglycemia, and this is going to worsen your diabetes. You in diabetes, you have difficulty in controlling blood sugar. So if you are stressed, this your diabetes is going, the blood levels are going to be increased in sugar. Okay, same with cortisol and adrenaline can also increase your blood pressure. You need that heart pumping to deal with the stress. Chronic stress can always keep your heart in that edge. So that is why if you are unable to control diabetes and hypertension just by medication alone, then you may have to evaluate that, am I suffering from of course, that you're suffering from stress, but you have to acknowledge that maybe my stress and my low mood is making my diabetes and hypertension not get better. Okay, so lifestyle disruption affect diet, activity, sleep, and medication adherence. So this is what is common in all the chronic illnesses, that you will have lifestyle disruption because of depression or anxiety, and this can lead to disruptions in diet, activity, sleep, and medication adherence, which is important for controlling diabetes, depression, or any other chronic illnesses. Okay, so here we have also seen reversal after remission. So if you treat somebody with depression who is having uncontrolled diabetes, the BP is shooting up, if you treat depression, and this improves the self-care, and this stabilizes the health markers, which essentially means is if you treat depression, a lot of times we see that diabetes has either control or even gone into remission, that sometimes they may not even require medication after correction of depression or after treatment of depression, or hypertension has gone down and then we have to stop the antihypertensives because they have been treated. So depression is something that can masquerade as diabetes and hypertension also, or it can worsen the hypertension and diabetes also. So it is always a good idea to look for any mood changes that are there and to treat them. So resistant hypertension or uncontrolled diabetes may sometimes be psychiatric in origin. So the clinical insight that we have is, some older adults, physical illness may remit after addressing underlying mental health issues. Yeah. Okay. So signs to watch for in the elderly. Just a second. Yeah. Okay. So signs to watch for in the elderly. So if there are any, I think you all have known this. I think there must be counted discussion, but still it is always good to recapitulate. Persistent sadness or hopelessness. Okay. So sadness, like I said, coming and going is fine. You are supposed to feel sad if something bad happens, but you should recover from it. If you feel that most of the time you're feeling sad over 2 weeks, 3 weeks, and the overall mood in the whole day is sad, and you feel hopeless, that there is no hope left, I can't do, there is nothing left in my life, and I could not do anything in my life has been a waste, and what can I do in future? So these are something that are the signs that a person has depression. Or loss of interest in previously enjoyed activities. They used to love playing games, going out, now they have stopped doing all that. changes in sleep and appetite. They are not eating properly. Their sleep is fragmented, not sleeping properly, feeling tired most of the time. Withdrawal from friends and family. Cognitive changes such as confusion and forgetfulness. A lot of time in depression, we will have cognitive changes where the person is confused, forgetful, what we call in local language, sorry, not like common language, absent-minded. Rather than forgetting, he is more absent-minded. Increased irritability or agitation, or poor adherence to medication or therapy. So this is why I have highlighted is that even poor adherence to medication or therapy can be a sign that the person has depression or anxiety or any mental health issues. Okay. So integrated psychiatric care is essential. So coming to the previously discussed point, it is not just the physical symptoms that need treatment. Mental health also should be addressed holistically. So there can be, just give me 1 minute. So psychiatric consultation along with medical treatment. So cognitive behavior therapy for chronic illness adaptation. This is something that the psychologists have to do. But therapy, CBT is a kind of therapy that can be tried for chronic illnesses, and support group for peer validation. I have made it in red because this is what one of the things that we are doing now. So I'm very happy to be a part of such group, or opportunity to talk in such a group. So support groups for peer validation. It is important that people meet other people who are of their age, share their views and problems, and look for solutions. And yeah, so that is why support groups, mindfulness and relaxation techniques for anxiety and pain, family counseling to improve home environment. So in older adults that we have observed that a lot of mental health issues arise from family disputes or family problems. Okay, as we grow older, we hold our relationships as very important. Probably a younger generation will not care much about, if they are not talking to their brothers, sisters, or they are hardly communicating with their family members. But as we grow older, we tend to, give importance to these things. And if something is there which is, uh, you know, disturbing the harmony, then it is very easy to get a mental health disorder, maybe depression or anxiety, and that can affect the physical health. So family counseling can be tried to improve home environment, and there can also be social support services to reduce isolation. Uh, so I tried to talk about the social support services. So what can be done? Social support services to reduce isolation. I tried to search for the Indian context. So the first is family as the first support system. So we have traditionally strong. There has been now weakened by migration and nuclear setup. So the joint family was something that was uh, strong, source of resilience, of support to people, especially older adults. Okay, so as we grow older, we need somebody. Okay, I don't know what is this. Yeah.
You are online, doctor. You are online. I think.
Yeah.
Somebody has meddled with screen.
Yeah, it's okay, no issues. So, so as I was discussing, joint family was something, a source of resilience and support in older adults. And even what is happening with nuclear setups is that despite the family members or the children taking care of them physically or taking care of their physical needs, they definitely feel the emotional neglect, because all of us are busy at such age, and that emotional bonding is definitely lacking. So we can promote family counseling and intergenerational bonding, in which you bond with the your kids or other people, so that you can have a better home environment. Yeah. So there are also some government initiatives such as NPHCE is National uh, Policy. I forgot, just a second. Is my screen visible?
Very much. No problem.
Yeah. Yeah, so National Program for Healthcare in Elderly. So this was an initiative that was started by Ministry of Health and Family Welfare, where they have created geriatric clinics and community care in certain at the level of district, and these are where they can have some services rendered to the geriatric population. Then we also have something called IPOP, which is integrated program for older persons, in which they have uh, made some uh, daycare centers. So they fund some daycare centers and mobile units which serve the geriatric population. We also have a elder helpline, and this is a toll-free elder helpline 14567. But the challenges are low rural outreach. So they have still not reached the rural population where a lot of older adults reside, and there is poor scheme awareness. Okay, so these are the challenges that government is facing with this initiative, but these are something that people should have awareness about. Then we have NGOs and community programs such as HelpAge India and Dignity Foundation, and they offer telecounseling and buddy system. So buddy system is what? They will attach an older adult with a college going student or a young person. So, be in contact and, essentially have some social communication with them. Then digital literacy classes for adults, which can help them, be socially connected to other people. And the outcome has been improved mood, confidence, and social participation. Then faith-based and intergenerational events. So this can be temples or gurdwaras where the older adults can take part or volunteer in langars or group rituals. Even at a very small level, the marriages ceremony that happens, or some ceremonies that happens in the family, I think older adults should be the one who should definitely take part in these, because these are the places where you socialize, especially for the women. Okay. Sometimes we have schools partnering with the elderly for stories, arts, and memory sharing, and this boosts self-worth and emotional health. Okay, so positive outcome with proper support. So studies show that when mental health is properly managed, chronic illnesses outcomes improve significantly. So we have better medication compliance, we have lower hospital admission rates, and improved functional independence and enhanced quality of life. You improve depression in a patient of Parkinson's, you improve depression in a patient of arthritis, you will see that they do better. They have lesser falls, they are able to walk better. Okay. And they are able to do their daily activities more. Okay, so this is why it is very important that even if they have a physical illness, you cannot attribute everything to a physical illness. We need to see if they have any mental health issues, and we can treat them, and this can lead to functional improvement in functional independence. Okay. Finally, I wanted to summarize in a few take-home points. So your body and mind are connected. Illnesses can affect mood, and low mood can worsen health. Here, illnesses are physical illnesses. Mental health care helps. Talking therapies, medication, and relaxation can ease suffering. Depression can raise blood sugar or blood pressure. Treating it helps both mind and body. Watch for signs of depression: sadness, forgetfulness, sleep changes, or not taking meds or not taking medications. Treating mental health boosts quality of life, independence, and happiness. So these are my references. I forgot to title it references. So these are my references. And with this, I end this session. Thank you.